For the first time in Canada, a Calgary hospital is using virtual reality on its patients. Physiotherapist at Calgary's Rockyview General Hospital, Jacqueline Frank, joins us now. Jacqueline, thank you so much for being here.
Oh, thank you so much for having me.
So you're using virtual reality to help ease very real pain. How effective is this?
Well, we found that so far it's really effective with our patients. We've measured it by using a pre-test and a post-test with our patients. So they fill out the pre-test after they've received their wound care, before they have the virtual reality, as well as after their treatment with the virtual reality. And we found so far that we've had about a 75% reduction in patient discomfort, which is measured with patient pain, anxiety, and nausea, and a 30% in overall patient experience.
Now, from what I understand, these virtual reality headsets come preloaded with certain experiences. What are some of the experiences that can allow them to disconnect from what's actually happening to them?
So we have about 12 experiences that we've been using in the hospital. We have everything from sitting at a campsite, you can swim with dolphins, you can be in a meadow in Jurassic Park hanging out with the dinosaurs, watching a Cirque du Soleil show. So there's lots of options for people.
Now, what are some of the side effects? Are there side effects to this treatment?
So far, we haven't found any side effects. We actually did measure patient nausea just because we weren't sure if being in another environment would make people dizzy or woozy, but we actually found that patients' nausea improved when they were watching the virtual reality.
Now, we are talking about very real pain, and there are protocols involved in pain management. There are certain drugs that are used for certain types of pains. Are you finding that you are administering fewer drugs than you would have otherwise been using?
Now, we didn't take away any of the pain medication drugs from the patients, but what we did notice is lots of our patients received the same amount of narcotics, but had much lower pain scores.
Wow.
So, yeah.
I mean, listen, a lot of hospitals share information. They're always looking for best practices to get optimal results. Have other hospitals reached out to you to learn more about your program?
Absolutely. We've had a ton of interest in our virtual reality program. We have an amazing telehealth team at our hospital who's working with other units. We're working with the ICU, with the maternity unit. We're talking with Children's Hospital, with the burn clinic at Foothills Hospital. So there's lots of places that have reached out and are really interested in this project.
Yeah, I've got to think that it could be used in many more settings than the one that it's currently being used in at your hospital. I mean, this is a portable and transposable sort of technology, isn't it?
Yeah, and I think we're starting to see more and more projects come out where people are starting to use virtual reality for management of pain and anxiety. So I think this is just the tip of the iceberg, and it's only going to get bigger from here.
Jacqueline, this is wonderful news. Thank you so much for sharing it with us.
Thank you very much for having me.